Hello everyone and welcome back to my channel. If you're just stumbling on my video for the very first time, my name is Dorothy Shitanga and I'm a pharmacist living and practicing in Nigeria. So I promised one of my viewers I was going to answer a question. So she put up this question that, hi, please, can you talk about drugs to use to bring back missed period for month? Okay, so first off, before you say you have a missed period, there are a lot of things that could lead to you having a missed period. One of the major things, or one of the first parts you want to look out for, is pregnancy. So if you're sexually active and then you miss a period, one of the first things you want to do is to run a pregnancy test. There are home pregnancy test kits that you can get and run them using your urine, preferably the early morning urine. So if you run a pregnancy test and it turns out that you're pregnant, obviously you will not have a period. But if you run a pregnancy test and it comes out negative, then it tells you that there's something else wrong. So another thing you also want to look out is stress. So even though a lot of people tend to ignore the influence of stress on our cycle as ladies, it has been proven that most of the time for ladies, when we are excessively stressed, it usually leads to a delayed period or sometimes a missed period. And for other people, your period might even come in earlier than expected. So that's another thing you want to look out for. Have you been stressed lately? If you've been stressed, then that could be a reason why your period is not coming. And then another thing you want to look out for is contraceptive. Yes, it's very important we also look at this area because a lot of ladies tend to take morning after pill. These are progestin only contraceptive. All of this one is big English, but the most important thing is that if you're the type that is taking a contraceptive pill like Postino 2, post pill combination 3 and the rest, there are chances that your period might delay or there might be an alteration in your cycle. So it could lead to a delay in your period for 1 month, 2 months, depends. And sometimes when you discontinue that contraceptive, your regular period might come back back to normal. So that could also be another reason why you might be experiencing no period at all. And then the next part we want to look out for is PCOS. PCOS is an acronym for polycystic ovarian syndrome. So interestingly, a lot of ladies who come down with PCOS tend to have a missed period. Some of them don't see their period for 1 month, 2 months, 3 months. So if you're a lady, you're not seeing a period for that long, then it's alarming. So you need to, go carry out some tests. Most of the time when you run a scan, an abdominal scan, it's able to also tell you if you have a PCOS. So that's another thing you want to look out for. And this is another factor that could result to, in you having a missed period or no period at all. Then another thing you want to look out for is, are you overweight or are you underweight? If you are overweight, it might lead to the production of a lot of estrogen. And if estrogen is much in your system, then you might not have your period. And secondly, if you are underweight, you might not be having, your body might not be producing some of the hormones that are necessary, for your period to, go on. So that could also be another, interesting factor that you want to look out for. And another thing is, some ladies usually experience early menopause. Pre-menopausal signs could also be another reason why your period might delay. If you are, getting to the age of menopause, it's also possible that your menopause decided to kick in early, and that could also be a reason why you might miss your period. Yeah. Another thing I've also noticed over time and in practice is that for some ladies, if they have an infection, an untreated urinary tract infection or an untreated sexually transmitted infection and the rest, it tends to affect their menstrual cycle. So that's another thing that could also predispose you to missing or not having your period at all. Yes. And then for some persons, there are also other, disease conditions like, diabetes and the rest that could also, result to you not having a proper menstrual cycle. So you want to look out for all of those things. So if all of those things are no for you, please, it is important that you run some tests like hormonal profile tests to look out for some hormones that might be up or down there, and then they might give you medications that will be able to help you to bring them back to normal. I want to believe that you learned something from this video. So for the person that asked the question, please, I'm not in any position to give you any particular, to tell you, oh, take this medication, it's going to bring back your period. You need to know the underlying cause of, that particular thing. That is the only time when you can now say, oh, this is the drug. So you can see I mentioned a whole lot of things that could, lead to you missing your period. So if I want to give a medication, where do I want to start from? Do I want to give a medication to take out, to remove the pregnancy? Do I want to give you a medication that will reduce the stress? Do I want to give you a medication that will help you? There are a whole lot of things. So you need to identify first exactly what is causing that. And once you're able to know the cause, then you can now address it, totally. Until I come your way next week, do take care of yourselves and bye.